welcome to Mid Nation. My name is Dr. Lanier. I am joined today by Dr. Joy Kong. We are here to talk about stem cell therapy. I would like to have you, Dr. Kong, introduce yourself and tell us what you do.
Okay, sure. So nice to meet you, Dr. Lanier. Yeah, I'm very passionate about what I do because I think I'm at the very cutting edge of medicine, period. In the past, at least the Western path of medicine has been focusing on attacking the body, looking at the body as if it's adversary, and using drugs to change how the body is functioning. But now I have a way to guide the body and it's almost like coaxing or talking to the body so the body can wake up and use its own potential to heal. So stem cell therapy is exactly that, because we're tapping into the intelligence that's embedded in cells. These cells are the ones that actually produced or generated the entire human being based on the blueprints that are in these cells, which are the DNA. So stem cell therapy is a fundamental this shift in medicine, because we are literally tapping into the intelligence and bringing that intelligence into the body. So whether or not you're using your own stem cells or using a young person's stem cells, you are tapping into the clear message that are embedded in these cells, and that can wake up the body's ability to just repair itself. So that's kind of the cap of what stem cell therapy may be.
That's awesome. I always talk to my patients, our body is the best, therapy that we have, the best medicine that we have. Our body knows what to do. We just have to let it. Sometimes like you have an ankle sprain, you don't need surgery for ankle sprain. You don't need, just stay off of it. Let your body deal with the inflammation, and let your body does what's the best, what it does the best, repair itself, right?
Yes, exactly.
Talk to me about how you got into it.
Well, just to give you an idea, I actually started out after medical school. I specialized in psychiatry. So we mentioned a
No
little bit about
way.
mental health. Yeah. So I was just fascinated by the brain. Like, why do we cry? Like, how are we getting psychotic? Like, how do people completely leave reality, right? So all these things were fascinating to me, and the brain is the frontier, as far as our understanding and how it works as an organ. But then the brain, it's also just one of the organs. It's affected by all the other organs. But traditional type of psychiatry, that how we were educated in, it really are not taking into account of every other organ, how that's affecting the brain. So to me, that wasn't adequate. As a doctor, when I'm looking at a person, I felt that was where psychiatry was lacking. And I was always interested in a more holistic way of looking at the body, which means that you are looking at how every other organ is functioning in the body, and how we can actually optimize and prevent illness. So all these were not talked about in traditional psychiatry. So in my quest, even just for my own health, also for my patients and how to optimize their health, that's when I got into the integrative medicine aspect and quickly becoming familiar with stem cell therapy. So stem cell therapy really is a game changer, but all the other modalities in anti-aging medicine is fantastic. And I utilize them in what I do, even in stem cell therapy, such as hormone replacement, right? Microbiome optimization, detoxification, and different nutritional therapies, mitochondria health, and all these are important. So how to enhance the body as a whole, and the brain is kind of become one of the beneficiaries, right? Your entire body is benefiting from all these modalities, and the brain is just one of the organs. So we're in a sense not giving a preferential treatment to the brain. We're looking at the entire body, and we're trying to enhance the entire body. So basically I switched from psychiatry to anti-aging medicine and stem cell therapy, because I don't think I need to separate the brain out. I actually believe in all specialties. All the doctors should learn anti-aging medicine first, should understand how to optimize all the organs, and promote regeneration and prevent the person from getting sick in the first place, that's where the foundation of medicine should be. And then if there are problems in particular organs, you need to be familiar with the organ, and that's fine. But every specialty, every doctor needs to understand the entire mechanism of how the body functions. So that's where I just one left psychiatry, because I believe what I'm doing is benefiting the brain. And psychiatry, if you want to use medications, that should be the very last resort. And a lot of times you really don't need to use these medications that have a lot of side effects and have a lot of issues. And I've written plenty of them. So I know all the problems associated with them. So that's kind of my journey of discovering a new way of doing medicine and making fundamental changes, not just in the brain. Now I'm treating patients with all kinds of conditions that I had no business treating before. Right? As a psychiatrist,
That's
we were
yeah,
told not even touch patients. Now I'm doing IV treatments, and
so cool.
I've treated people successfully, people with like COPD, with liver cirrhosis, with all kinds of degenerative brain diseases, with foot problems, right?
No, I bet.
Musculoskeletal
Yeah,
injuries, with all
yeah,
kinds of orthopedic problems, and people with diabetes, with autoimmune conditions. So it's so wide ranging. And I'm not a specialist in any of these conditions, yet I'm able to produce results that almost none of these specialists can produce because they don't have the tools I have. So that's
yeah.
how my career has transformed.
It's impressive. Looking at you too, I'm thinking how beautiful your skin is. I'm thinking about what's your skincare routine. I'm sure it has
Oh,
to be with something stem cell. You probably don't know
yeah,
that,
I,
but
I
you
I'd
look
say my main secrets, one is stem cells. Well, it's really stem cells because you can use some laser technology as well, but I think there's fundamental shift in how my skin or just all my internal organs have been after I started doing regular IV stem cells. And I also produce the skin cream that contains stem cells and is 100% natural. So that's something that's really awesome. So that's the only skin cream I'm willing to put on my face for the last 4 years. So it's called Chara Omni. And I'm 53 years old. I
no,
know.
no, no. There's no way. You are 53.
Yes, yes.
You look
And most
amazing,
women don't
guys.
want to
I
talk
don't know if
about
you have
their
seen her
age.
before. Everybody needs to Google Dr. Kong. She looks like she's in her 20s. She's amazing. This is
Oh,
great.
thank
I'd like
you.
to know more about the skin cream then, and also the IV stem cell therapy.
Yeah. So I have a lecture on YouTube talking about the anti-aging benefits of stem cells. So that's a lecture I presented in, different conferences, but that actually goes over the science behind it and the clinical
Okay.
evidence. So it's not just in theory, we think stem cells can delay aging and can rejuvenate the body and can actually make an organism younger. There's actually research evidence on animals, of course, because you can do a lot more. And there's some human evidence as well, but in animals you can do a lot more, such as when they did rat study. By the way, I'm never really happy about what happens to animals.
Yeah.
I wish there's a different way of doing this, but in animal studies, not only they showed regular IV stem cells can extend the lifespan and health span of these animals by about 30%, but when they actually dissected the animals' brain and muscles, all the markers, everything was reverted to the younger state. So whether or not you're looking at the senescent markers, how old the cells are, looking at the amount of neurotransmitters or growth factors they secrete, and the waste accumulation, the levels. So all these can be markers showing how old the cells are. And when you give the mice or rats stem cells, actually reverted everything back to the level of the younger animal. So there's concrete
So the
evidence.
stem cell that you're giving to the rats, where are they? Where are you getting them from?
It can be from a young rat, right? So
Okay.
when you give young stem cells, and there were studies that actually were giving human cells as well,
Okay.
young human stem cells. Yeah.
So the IV stem cell therapy, they're not produced from the patient self, right? You're getting it from a younger stem cell.
Yeah.
Okay.
So you can do a person's own, but your own stem cells will be your own age. It will be
Sure.
aged. So there are a lot of there are disadvantages to that. One, it's hard to do that repeatedly for anti-aging purposes, right? You're just repurposing your own cells, and the more you get from your own body and reinfuse, the more diminished your supply will be
Okay.
because
That.
the
Yeah.
cells, once you get it out of the body and process it and give it back to the body, there's a lifespan. There's a time, there's a limit on how long the cells live, like all life on Earth. Once you
Yeah.
woke something up and then it is doing its work, then you have diminished your supply to some sense because the cells can keep multiplying, right? But it's not inexhaustible because as you age, the number of reserve, the amount of reserve dwindles to like a fraction of what you had when you were born.
Yeah.
It really falls off a
It's like
cliff
that.
as far as the reserve. So when you take it out of the body, that means the cells have to reproduce, have to make more of itself. In that process, you not only there's degradation in the DNA, but you're also losing certain number of cells. Just they only can multiply so much. So yeah, you're diminishing your own supply. But another thing that's really important point is that you also are getting cells that have lost some intelligence. And that causes certain risks because if you put back in your body cells that are really good at helping everything to grow, but have reduced in its capability of recognizing cancer cells, now what happens? You can tell all the cells to grow, including cancer cells, because we all know cancer cells emerge all the time, right? It's not
Yeah.
a secret, but your immune system is so good at getting rid of it, especially when you're younger, which is why age is the biggest predictor of cancer, is
Yeah.
because your body has diminished immune capabilities. And the stem cells, when it's much younger, it's really good at recognizing cancer. It can help you get rid of it. But when you're older, the stem cells, when you put it back in your body, it has lost a lot of those capabilities. So it can potentially tell everything to grow and, really hasten the growth of all cells, including cancer cells. And now you got elevated risk for exacerbating cancer. So that's something people need to understand as well.
Yeah. No, that makes sense. I'm looking at your website, and you talked about stem cell treatment and also pain management. How does
Mhm.
that like how does that correlate? What do you guys do to help with pain management? Because we see a lot of patients here, neuropathy pain, pain from uh, surgeries, CRPS. There a lot of older people in general, they are in pain. you
Right,
know?
right. So pain is not a disease, right? Pain
Yeah,
is a symptom. Pain is a signal our body is telling you something's going wrong. So that gives us a clue, I mean, or a kind of a alarm of going in and finding out what is causing it. And
yeah,
pain is most commonly associated with inflammation. So injury and inflammation. Of course, inflammation is always the link pretty much to pain. One of the biggest benefit of stem cell therapy is the anti-inflammatory effect. So when you calm the inflammation, you're calming the signals that's triggering pain. This is why one of my first patients was somebody that suffered from just raging pain problems throughout his body, just severe pain for years. And then
yeah,
after one stem cell treatment, he had almost no pain. He couldn't believe it. This was a person who was going to cryotherapy, several times a week because he was trying to calm the inflammation and trying to not suffer from the pain. And the stem cell therapy just transformed how he
yeah,
was. It's powerful because of what these cells can do. So yeah. So pain is the clue to look for things that are going wrong, that's triggering the inflammation.
yeah,
Whether or not it's pain as a result of immune dysregulation or pain as a result of local injury, the cells can have the ability to go in, shift immune environment, because that's one of the biggest benefits of stem cells is the shifting from the inflammatory to anti-inflammatory state. So shifting immune system to be more anti-inflammatory with anti-inflammation, that's when you can promote regeneration. If you are stuck at an inflammatory state, then that's where you're at. And too many people are stuck in that stage. So, I think that's what's so exciting about stem cell therapy is that it really quickly can shift that immune orientation.
Yeah. Well, so you said that after one treatment of stem cell therapy, he got better, his inflammation improved. That is incredible. That's incredible. What does
It
stem
is.
cell therapy entails? Is it like 1 day IV treatment, or it's like a 6 weeks therapy? And if
Yeah.
patients are listening to this and they want to know more about it,
Yeah.
can they?
So I always say there are kind of two prongs to stem cell therapy. To the most crucial aspect. One is the quality of the cells. You have to get the right cells, the right source, the right processing, and they need to be healthy and vibrant. So the source of cells is one crucial aspect. And the second aspect is the art of how you put it into the body, right? How do you, where do you put it? And there's either a systemic approach or a local approach. There are many ways of putting in the body. You can put it through IV, do it intramuscularly. You can inject into the joints. You can do intranasal to get more access to the brain. You can inject into the different organs, any organ, right, in the body directly. And you can do nebulizing. You can
Mm,
do eye drops. There's so many ways of
mm,
doing it. But
yeah.
the mainstay, the main way that I do it, that have found it to be very powerful, I follow research, right? So a
Mhm.
lot of research are using intravenous route. And what I've found and what I've read from research is that the intravenous route not only is going to get the cells to the area that you need repair for, because they do have a homing capability. So stem cells, especially MSCs, the way I understand a lot, mesenchymal stem cells, they have the ability to travel in the bloodstream. Usually they are around your blood vessels. They're kind of
Mhm.
hugging your blood vessels. They're all around your blood vessels. Anywhere you have blood vessels, you have these MSCs. And they sense what's going on in the blood and also sense what's going on in the neighborhood. So they almost are these like the conductor, I call it conductor in the symphony of regeneration. So
Mhm.
they are seeing what's going on throughout the body, right? The entire symphony. And then they're sensing what's flowing through the blood. And once they sense certain signals, they can't squeeze themselves into the blood vessels and start swimming upstream like a salmon, looking
Yeah.
for the origin of these signals. And once it finds the highest concentration of these signals, it can squeeze itself out of the blood vessels and get to the local area to exert their capabilities, which means they can directly secrete anti-inflammatory signals. They can send information, signals to the bloodstream and get your immune system involved. They can talk to the local stem cells and basically giving a big nudge to your local cells
To make
saying,
more.
hey, your job is to replenish the local
Yeah.
tissue, right? It's not my job to transform and become the new
Yeah.
tissue. I'm here, I'm the conductor. I'm
Mhm.
telling you to do your job. So
Mhm.
that's kind of, the really exciting role of these cells. So when you send the signals, that's when the regeneration can happen. And why is it powerful to put the cells in the IV stream, right? In the IV, because then they can find their way, because that's what the cells were doing in the body before anyhow. That if
Trying to
they're
find their
needed,
way. Yeah.
they're in the bloodstream and then they find their way into the place that they're needed. But not just they are finding their way into the place of injury and inflammation and get out of the blood vessels. In the process, while they're traveling in your bloodstream, they're also talking to your immune system. They
Mhm.
they One of the major organs is the spleen, is the largest immune organ in your body.
Mhm.
There's a whole lot of stuff going on in your spleen. So it can talk to all these cells in your spleen and recruit them to do their job. So it, in a sense, is massively waking up your immune system. So these two are very powerful functions, the local benefits and talking to your immune system. This is why I think whatever condition you have, if you are able to do some kind of IV approach, then you are going to maximize the benefits that you're seeing. So
I,
IV,
I
I think,
agree.
yeah, but you
I
can
agree. And
always add more locally because whatever you put in IV, there may be smaller amount that gets to the area that you want it to get to, because wherever you have inflammation, the cells tend to be attracted. But if you have lots of inflammation going on in your body, then they may be, kind of be distracted in all these areas and distributed in many areas, then you may not have enough in the place that you really want help for. But what's funny is that sometimes I'll give people an IV treatment. What they're looking for may not resolve, but some other things resolved. So that can
yeah,
happen. I
yeah.
can't predict exactly how the cells, where they're going. Now I have more ways of directing the cells because I'm using certain technologies, certain lasers, or you can use ultrasound. You can use technology to attract the cells to a particular area, but you always are going to get more if you inject locally.
Which is great because it's a whole body treatment. I mean,
Yeah.
who won't like that? I love that. You talked about choosing the right cells and right sources. Do you ever see rejection if you inject that on a in a patient? And is there any rejection from
No.
that?
So that comes to the subject of, the sources of stem cells, because that's a large subject. So from what I do using umbilical cord derived cells that's rich in mesenchymal stem cells, no, I don't see it. But
Good.
one of the earliest, well, the first stem cell transplant was a bone marrow transplant. And that you're transplanting from one person to another. So you're using a type of stem cells called hematopoietic stem cells. So those cells, if you do not match from one person to another, you're definitely risking rejection, because from one adult to another adult, the adult stem cells have expressed different surface markers. They're further differentiated. So they're just a little bit more mature, unlike cells from the umbilical cord. So if you're getting hematopoietic stem cells from one person to another and a lot of immature immune cells, if the person is an adult, you will need a matching process. But this is what's interesting.
Yeah.
Perfectly matched stem cells from a bone marrow from an adult to another person, even if it's perfectly matched, there's still a chance of rejection. But if you use umbilical cord blood stem cells, and the cord blood stem cells is very similar in composition to the bone marrow stem cells. They're really flowing through. It's the blood flowing through the bone marrow. It's kind of almost, one system. But when you use umbilical cord blood stem cells, even if you do not match at all, and you give it to another adult, a person, of course, from the umbilical cord, from a newborn baby to another adult, completely unmatched, there is lower chance of rejection than perfectly matched bone marrow transplant. This
Wow.
just illustrates what happens when you age, when you
Yeah,
mature. That
that's
there
true.
are changes. Stem cells are still stem cells, but they're different kind of stem cells now.
That's true.
So you have to treat them differently. This is why I use very young sources, right? From a young, healthy newborn that has very long telomeres, has its full power of recognizing cancer, right? Of detecting
Yeah.
senescent cells, of secreting more growth factors, and just have higher vibrancy and have better mitochondria. So these younger cells can exert better benefit with lower chance of potential problems. But if you do not include mesenchymal stem cells, if you're just doing cord blood cells, which is rich in hematopoietic progenitor cells and all these immature cells, so they have a lot of hematopoietic stem cells and these what's called mononuclear cells, these immature primitive immune cells, then there's still a chance of some kind of adverse reaction like chest tightness, sniffling, or low grade fever, malaise. So those are a little bit of, kind of a low grade rejection reaction. Yes,
Mm.
I've seen that happen when I first got into the field when I was using just umbilical cord blood cells. But quickly I realized, wait a minute, mesenchymal stem cells is actually immune calming and is actually used to treat organ rejections, right? It's used to treat graft versus host disease. Is it actually can prevent this kind of reactions. So umbilical cord tissue, the Wharton's jelly part, is so
Mhm.
rich in mesenchymal stem cells. That's when I decided to develop a product where I'm incorporating that portion of the burst tissue along with the umbilical cord blood. Now you've got the best of both worlds. You've got these blood regenerating components that's really great for blood vessel regeneration, for immune system health. And then you got the mesenchymal stem cells that's the conductor of the symphony of regeneration, right? They
Yeah.
can help your body coordinate this regeneration effort and talk to your immune system. And they can even help the hematopoietic stem cells to to stay in the body more effectively, to work better. So they're synergistic. Now you got the best of both worlds. So I think both are important, but the mesenchymal stem cells can help reduce the overreaction from the immune system. This is why when we use our products in the clinic, that I don't see any kind of the type of reactions that cord blood products can cause, the mild rejection type of reaction. But
Yeah.
if you start to replicate these mesenchymal stem cells like what they do overseas, and I think some companies are doing in the US, not legally, but they're sending it to doctors, and people are using these expanded products, which means that they're growing these mesenchymal stem cells to huge numbers. Now we start to see rejection type of reactions because when the cells are replicated, they start to age. Remember,
Mm.
I was saying how an older person's stem cells can cause more rejection type of reaction.
Yes.
Why? Because they start to express surface markers that mark
Right.
them as their old owner, right? The previous person where they were at, they were in. So the DNA was consistent with the previous person, and then they start to express surface markers and proteins that really it's consistent with the donor. Now
Yeah.
in the recipient's body, you can cause some kind of rejection. All of a sudden, the second person that has these cells will realize, wait a minute, where are these from? Who
Yeah.
are these? And you start to mount an immune reaction. So when you start to grow the cells in large numbers, that's when you start to see these kind of reactions. And that's why I really adhere to what's called native cells, which means unmanipulated, that I'm not growing them to huge numbers. And I don't believe you need to grow them to huge numbers because I've treated so many patients and I have taught so many other physicians to, treat different kinds of patients with all kinds of conditions with incredible results. And the results are just as good, if not better, than people who are going overseas and getting a huge number of stem cells. But those are expanded cells. So they're not native cells that can go into your body and work with your body. They've already
Yeah.
been sitting in an incubator and start to just multiply themselves and going through the stress of being in this foreign environment. They're just sitting there with these nutrients that these labs deem as essential for their replication. But that's not a human body. So it doesn't have the capability or the opportunity to adapt to a human body. So it decides to secrete sometimes inflammatory molecules, and that's one reason, not only secrete or grow more surface receptors, but also these inflammatory molecules. And altogether, when you transplant these expanded cells, then you can cause a little bit more rejection, and people can get extreme fatigue and or other sniffling and malaise, and that's very common. So I don't think that's necessary. And also you can potentially lose potency. I've seen studies where the cells after replication, they lose their potency. So at higher number of cells, they actually have lower benefit. So why would I want to do that, right, with my
No, I
patients?
don't. Yeah. No, it makes so much sense. This is so impressive. We talked about the rejections. Talk a little bit. I don't want, our listeners to worry about rejection symptoms. Is it similar as like having flu shot? You have the sniffles and low grade fever and then you're fine, or you have to be hospitalized after if you have to have a rejection?
But it really depends on the person and the replication process. So the cord blood, the type of rejection reaction usually is short-lived within a few days. But I've heard people using expanded cells the malaise and the fatigue can last for months. So, for example, one of the patient who came to see us went to Mexico to get stem cell treatments. And it's actually a well-known clinic that was featured on Joe Rogan's show. So he, so okay, big name, and
Yeah.
here's a clinic, talked about by a celebrity podcaster. And unfortunately, he got extreme fatigue for 2 months. And not just him, but the 20 people that he was in touch with who were there on the same day. Everybody got the same response, extreme fatigue for months. So that can happen as well. But the interesting thing was, after he came to our clinic, getting the cells we use at a fraction of the cells that he was getting, probably, 1/6, 1/7, a very low number
Yeah.
compared to what he was getting. Not only there was no fatigue, he got increased energy within days, and then start to experience improvement in symptoms within 3 days. When with the other treatment, he did not notice any benefit until 2 months later. So there's a big difference
Yeah,
in these.
knowing your sources. You said it earlier, knowing your sources, you guys pay attention to where you're getting your stem cells. And if you're just buying it from whoever is selling it, then you can get symptoms and you can get other issues. If we have to order a stem cell treatment from you guys, how does that happen? Do we need to come to where you are, or is there an online way of ordering it? And can we administrate it ourselves?
Yeah, so only licensed, health practitioners can provide the treatment. So anybody that's able to, is licensed to inject, right? Inject in medical treatment. So that will include medical doctors, MDs, DOs, naturopathic doctors in states where they're allowed to do so, nurse practitioners, podiatrists, and dentists. So these are the doctors that we, or the high level healthcare practitioners that we are able to send products to. So I also founded a stem cell company that we send products to doctors throughout the country. That came from realizing that a lot of these companies are businesses and they're not putting quality first. And I realized, okay, I just have to do it myself,
Yeah.
stem cell field is a like this exploding field kind of growth, and all kinds of people are in this business, the line of business. And unfortunately, I just saw too much of people putting money first before quality. So I decided to start my own company. And so we only sell the products to these high level healthcare practitioners. And then these practitioners will provide the stem cell treatment. So of course, I have my own clinic in Los Angeles, and we see a lot of patients from all around the world. And yeah, it's very exciting. The kind of stuff I've been seeing, it just is makes medicine really fun. So, and I want to
No.
bring that kind of inspiration and kind of excitement, even for a healthcare practitioner. I want to
Yeah.
bring that to people.
Oh,
Have
yeah.
fun, make a
Mm.
difference, be
Yeah.
effective.
Yeah.
That's the bottom line.
No, I love it. I love everything about it. I think you're changing the treatment plan. You're changing healthcare in a way, something that can treat the whole body and something kind of holistic, which
Oh
is
gosh, I
great.
can't think of anything more holistic than
Yeah.
stem cells. It's
Yeah.
addressing everything all at once, all these
Yeah.
organs. Yeah,
Yeah. No, it's impressive. Well, Dr. Kong, thank you so much. I mean, this has been very enlightening, and I'm sure a lot of our patients and followers will start reading about stem cell, and they probably they will try to find you, because I'm looking at your website, and I might need to get some for me and my for my patients.
Yeah, let me tell you,
Uh,
everybody needs stem cells because, if everybody's aging, right? No one has ever escaped the aging process in human history, but now we can slow it down by decades. I believe
yeah.
with regular IV stem cells, you can easily stall the aging process, like stopping it or sometimes reversing it for 15 to 20 years. We can extend the human lifespan and healthy lifespan by
Yeah.
15 to 20 years easy with stem cells. So this is transformative for medicine. And when you can reverse the aging process, slow it down by 7 years, you are already cutting down the rate of chronic illness by 50%. And I believe with regular IV stem cell treatments, you can slow it down by 15 to 20 years. And that means we may be able to cut down the rate of chronic illness by
Yep.
75% in humans, in the entire society. I mean, how incredible that will be as far as productivity and enjoyment and happiness. I mean, it's just transformative for human life and human society. So I think everybody can benefit from that. Of course, anybody who's sick, should look at this as a possibility to really jumpstart your body's ability to repair. And then anybody who even if you need surgery, do stem cells right before, right after. You're going to heal twice or three times as fast. That's been
Yeah.
consistency. I've seen that in my patients consistently, not just me, but other doctors as well. So you can heal so much faster, so much better. Your
Yeah.
tissue, the scarring is going to be much less, and so the healing process is going to be more complete. Yeah, the application is so wide ranging. It's very exciting.
No, I bet. I bet. And I'm happy to be able to have this conversation with you because, for my patients, we do PRP injections for Achilles tendonitis. And now I can talk more about it in depth and
What
tell
I
them,
can tell you is a lot of
yeah,
doctors are realizing that it's so much easier to just give stem cells because, not only it reduces the time, like in the office, with all this PRP production. If you just get the stem cells, it's like PRP on steroid. It's going to
yeah.
do so much more. And so it's a superior form of therapy. Yeah.
I want to learn more about it. So if we have to order, um, I'm sure it's refrigerated, right?
Yeah, it's gonna
Okay.
be in the deep freezer, so either in liquid nitrogen or in an ultra low freezer that's about minus 86 degrees.
And then we have to use it within 24 hours.
If it's frozen, it can last like in liquid nitrogen, it can last at least 30 years. It probably can last much longer than that, but we say 30 years. As long as you keep them in deep freeze, the cells, there's almost no degradation. So it's
Okay.
it's it's like frozen in time and space, and until you're ready to thaw them out, and then that's when the cells come alive. All the metabolic activities start to happen. Yeah, so only until you're ready to use.
Okay. That sounds great. So if somebody's listening wanted to get in contact with you, how would they do that?
Yeah, so I think one of the great source of information, first of all, if people want to learn more, just go to my YouTube channel as Joy Kong MD, so Kong. I have lots of videos, there's many aspects about stem cell therapy. So, and I'm tireless in getting the information out because it's just important. If I don't talk about it, who's going to talk about it? That's how I started 8 years ago. My first video is funny. Is me being asked, Dr. Kong, what is a stem cell? So that's how I started. Okay, let's talk about it. But
Yeah.
yeah, there's so much information. There's so many aspects. So my YouTube channel is a great source of information. If people want to learn more about everything I'm doing and send in a contact form, just go to my website, joykongmd.com. They can see, the cream, the academy. So I found an academy. I train a lot of physicians. We do in-person certification training as well. So we certify doctors to do the treatment. And I also have the stem cell company, right? I wrote a memoir called Tiger of Beijing because
Oh, wow.
initially I came from Beijing when I was 20 years old. And how I got out of the country. That was kind of a really interesting, dramatic story. That's going to be a fun read for people. But it just shows you, if you have a goal, if you have a dream, if you believe something is the
Yeah.
right thing to do, that you're going to go for it. Because the same kind of courage that I tapped into to get to the United States is the kind of courage that I'm tapping into to kind of push forward in regenerative medicine because it's not an FDA approved therapy yet, because it's considered by some to still be on the fringe, which really is the forefront, is the cutting edge. So you can call it fringe or you can call it cutting edge, but it
Yeah.
takes courage to do what's not widely accepted. So that's the same, that's what you need, a little bit of bullheadedness to push for what you believe is right. Anyhow, so people are
Yeah.
interested, they can also read my book. So that's yeah, and my website is a good place to go.
Okay. Well, thank you so much. Thank you for sharing your expertise with us today, Dr. Kong. And we can't wait to hear more. We can't wait to look at your YouTube channel and learn more and talk about this with our patients.
Yeah, wonderful. Let me tell you, this is an exciting time to be alive and to be a
Yes.
physician.
Yes.
You can make so much difference. There are things that previously cannot be done. Now it can be done. Just to give you the latest example from my clinic, we treated a patient who had severe nerve injury leading to blindness in one eye.
Oh, wow.
44 years ago when he was 9 years old because he had to do a brain surgery. And we gave him stem cell treatment. Nothing dramatic, but we used our protocol. We give an IV treatment. Within 3 months, he's starting to see in that one eye. He wants to come back, do another treatment. These are kind of the stories that just, can give you
Not
chills, right?
not not only like he's able to see, I know nerve pain on the face is the worst. I mean, just having improving his pain, I'm sure this guy is, in
Yeah,
tremendous
neuropathic
gratitude
pain,
towards. Yeah.
we've done really well.
Yeah.
A lot of peripheral neuropathy. We've achieved just wonderful results for patients. Yeah.
So that's one of the things with my population, diabetic population, baby boomers 65 and up. There's no treatment as of like FDA approved right now. It's gabapentin
Mhm.
to mask the pain. So that's
Yeah,
something I'm going to look into with stem cell therapy with you guys and see if there are,
you can
because patients
really transform
they
some
don't
lives.
mind pain for it. Yeah.
Yeah, I mean, if you can improve the quality of your life, right? One of our
Yeah.
patients had peripheral neuropathy. He was using a cane for like a year, and then
Yeah.
after two treatments, he was able to ditch the cane. And then after three treatments, the neuropathy in his hands, which
Yeah.
prevented him from writing. As a writer, that was really devastating. And he wasn't writing for months. And
Oh,
then
wow.
within three treatments, he was able to write like 6 hours a day. So it's yeah, you're gonna make so many people happy
Yeah.
and bring so much healing. Yeah.
So the treatment is permanent, right? It's not like a temporary feeling better and then it's
You are
permanent
you
treatment.
are transforming the entire internal environment, and you are
Yes.
repairing tissue, right? That's where the
Science
improvement comes
behind it.
about.
Yeah.
But people always need to realize our body is a dynamic system, right? Why did you
Yeah.
get sick in the first place? So unless we remove some of the causes, then those forces are still there trying to push you to be sick. This is why the integrative approach is so important.
Yeah. No, I agree. Well, thank you so much. I'm
You're
gonna
so
follow you on
welcome.
Instagram. Learn more learn more about it. But yes, I hope, we get to work together.
Wonderful.
Hai, our clinical director, is from Beijing as well.
No
Have
way.
you, yeah, Hai Yin,
Oh,
Hayni Yin. She's brilliant. So she was excited to hear this. She's gonna be the one editing it and talking to you about,
no, that's
communicating with
fantastic.
you about it. Yeah.
Yeah. So yeah, people interested in my Instagram is Dr. Joy Kong. So Dr. underscore Joy underscore Kong. And I mostly I post content about stem cells or other, interviews. And I also have a podcast, the Dr. Joy Kong podcast. I interview different experts, but I also post some, a few things personal, like my recent trip back to China. I post some interesting clips and spectacular, things I've seen. Yeah, so people are welcome to check that out too.
Get to know you personally. I feel like Instagram is getting to know people personally.
Right?
And
Yeah, it's cool.
like follow their journey. Well, Dr. Khan, thank you so much again for sharing your time with us. And we look forward to following your stem cell therapy journey. And we would like to be part of it.
Wonderful. Yes, please join the movement.
I will. I will. Have a great day. Thank you so
You
much again.
too. Thank you, Dr. Lanier.